So if you're a new parent, or about to be one, you know there's this tiny, kind of weird-looking stump on your newborn that can cause a ton of stress, right? I'm talking about the umbilical cord stump. Today, we're going to demystify it and give you the one single, proven plan for taking care of it.
And hey, let's just get this out of the way. You are not alone in feeling this way. It's totally normal. As this doctor points out, new parents are in a state of panic over this little thing all the time. It just looks so fragile, and it seems like everyone, from your mom to your neighbor, has an opinion on what you're supposed to do with it.
So that brings us to the big question, right? With all this conflicting advice flying around, what does the actual medical science say? What is the best possible thing you can do for your baby's umbilical cord?
And the answer is to do absolutely nothing. Yep, you heard that right. The most advanced, the most protective, and the most effective method of care is to just leave it alone. I know it sounds crazy, but stick with me. Because by the end of this, you'll see why doing nothing is actually the most active and caring thing you can do. Okay, so let's dive into the why behind this. To really get why doing nothing is the gold standard of care, you first have to understand what the umbilical cord stump actually is and what it isn't.
The best way to think about it is like a leaf on a tree in the fall. The second your baby is born, the cord's job is over. Done. Its connection to the lifeline is cut. So it's not a wound that needs to be healed, it's just dead tissue that needs to do what a leaf does. Dry up, shrivel, and eventually just fall off all by itself.
Now, this slide shows the two absolute most important facts you need to burn into your brain. First, on the left, the stump has 0 nerve endings. None. So your baby can't feel it. If they cry when you're cleaning around it, it's probably because the diaper wipe is cold, not because the cord hurts. But second, and this is the really critical part, the vessels inside are still a direct highway into your baby's bloodstream. Keeping that stump wet is like setting up a 5-star buffet for bacteria, giving them a VIP pass straight into your baby's body.
So you see where this is going. Our one and only goal here is to help that stump dry out as fast and as safely as humanly possible. That's it. And to do that, we have a super simple, evidence-based game plan.
And that whole game plan boils down to these 5 easy rules. Number 1, keep it dry and exposed to the air. We used to use alcohol, but we now know that actually slows things down. Air is best. 2, expect it to get ugly. It's going to change colors, and that's totally normal. 3, always fold the diaper down, way below the stump. 4, it's going to fall off on its own, usually in about 5 to 15 days. Please never pull on it. And 5, just stick to sponge baths until the stump is long gone.
And this right here, this is your official don't panic guide. For the first few days, it's going to look kind of plump and yellowish, almost like jelly. Then it'll start to shrink and turn brown or gray. And finally, right before it falls off, it'll get hard, black, and shriveled up. All of this is exactly what you want to see. It means it's drying out perfectly.
Okay, let's talk about the tricky part, the advice you're going to get from well-meaning family and friends. A lot of these traditions come from a place of love, but honestly, they go directly against the one thing we're trying to do, keep that cord dry.
So first up is the healing paste myth. You might hear people say to put turmeric, oil, or even ash on it to help it dry out. The reality? It does the exact opposite. These things trap moisture right up against the skin, suffocating the stump and creating a warm, wet paradise for bacteria to grow. Worst case scenario, some of these things can even introduce deadly bacteria like tetanus. The only thing that should ever touch that cord is air.
Next up, the old coin trick. You'll hear that taping a coin over the belly button will prevent an outie, or an umbilical hernia. This is completely false. A hernia is a problem with the internal muscles. Slapping a coin on the outside does absolutely nothing for the muscle, but what it does do is trap sweat, cause nasty skin infections, and it's super painful to pull that tape off a newborn's skin. And finally, let's talk about the traditional thread tied around the baby's waist. While it has a lot of cultural meaning, it can actually be a real physical hazard. That little thread can easily get caught on the plastic cord clamp and rip the whole thing off before it's ready. And if it's tied too tight, it can literally cut into the baby's skin or even make it hard for them to breathe as their little belly expands after they eat.
Okay, so if you're not supposed to worry about how it looks or what your auntie tells you to put on it, what are the real red flags? When should you actually pick up the phone and call your pediatrician? Well, there are very specific objective signs to look for. Here it is. This is your doctor's official checklist. A little bit of crusted blood is normal as it separates. What's not normal is this: redness that is spreading out from the base of the cord, a really foul, rotten smell, especially if there's green or yellow pus. any active bleeding that doesn't stop with a little pressure. And of course, if your baby has a fever or just seems to be in a lot of pain when you touch near the area, any of those things, call the doctor right away. And for that first point, the red halo, here's a specific measurement to keep in mind. We're not talking about a tiny bit of pinkness right where the stump meets the skin. We're talking about a bright red, angry-looking area that is spreading more than ½ centimeter. That's about the width of a pencil eraser, out onto the belly. That is a sign of a spreading skin infection, and that's a doctor call for sure.
So, the most important thing to take away from all of this is right here. Your job isn't to heal the cord. Your baby's body, along with millions of years of human evolution, has already perfected that process. Your only job is to create a safe, dry space and get out of the way. By doing absolutely nothing, you are doing absolutely everything right.
So, this is your assignment. The next time you feel that little urge to clean it with something, or when a well-meaning relative suggests putting some kind of paste on it, I want you to remember this. Stand your ground. Trust the science. Keep it dry, keep it exposed to the air, and just let nature do its thing. You are making the best, most informed, and most protective choice for your baby. You've absolutely got this.